Hello students, in today's video we are going to study pharmacology of anti-herpes virus drugs. Anti-herpes virus drugs are the antiviral drugs that treat infections caused by herpes virus. Herpes virus is not a single virus, it is a group of DNA viruses. Now most important, infection producing herpes viruses are Herpes Simplex Virus, in short HSV, then varicella zoster virus, in short VZV, cytomegalovirus, in short CMV. Now herpes simplex virus is of two types, HSV-1 and HSV-2. Now HSV-1 is also called as oral herpes and it produces infections like cold sores, also known as fever blisters, infection of eye known as herpes simplex keratitis, then infection of brain known as herpes simplex encephalitis. Then HSV-2 is also called as genital herpes and it produces genital sores or genital blisters. Then varicella zoster virus causes chickenpox in children and shingles in adults. Cytomegalovirus can produce retinitis, that is infection in eye, pneumonia, that is infection in lungs, colitis, that is infection in intestine. It can infect other parts of the body also. Now, in order to understand mechanism of action of anti-herpes virus drugs, it is essential to first understand life cycle of herpes virus. Now, this chart explains life cycle of herpes virus. So, look at this cell. This is the host cell or the human cell that is infected with the herpes virus. Now, this is the DNA virus. Now, DNA virus binds to the host cell and viral capsid enters the host cytoplasm. Capsid releases viral DNA and this viral DNA is then transported to the host cell nucleus. Now, viral DNA transcribes and produces messenger RNA. Now, here it's very important to understand that this viral RNA is produced by using host or the human RNA polymerase enzyme. Now, this viral RNA further produces proteins. It produces functional proteins as well as structural proteins. Now, functional proteins like viral thymidine kinase, viral DNA polymerase. Now, it's very important to understand function of these functional viral proteins, why they are important. Now, viral DNA polymerase is required. This viral DNA polymerase is required for the replication of viral DNA. So, the virus makes hundreds and thousands of the copies of viral DNA by using viral DNA polymerase. Now, another very important concept that we already know is that of nucleotides. Now, nucleotides are the building block of RNA as well as DNA. Now, each nucleotide consists of a base, like for example thymine, and it also consists of sugar and phosphate. On the other hand, nucleosides consist of sugar and base, no phosphate. Now, enzyme thymidine kinase is responsible for the phosphorylation of nucleoside to produce nucleotide. So, here for example, deoxythymidine, which is a nucleoside, is phosphorylated by the enzyme thymidine kinase to produce deoxythymidine phosphate, which is a nucleotide. And this nucleotide here is the building block of viral DNA. Now, in addition to the functional proteins, structural proteins are also synthesized and these structural proteins are utilized for the formation of capsid and envelope of the DNA virus. Now, these replicated viral DNA and these structural proteins are utilized and large number of virions are synthesized and they are released. So, this is how virus DNA multiplies and produces the infection. Now, anti-herpes virus drugs like Acyclovir, Acyclovir, Gansey Clover, Gansey Clover, Cetophobia, Phoscarnate, all these anti-herpes virus drugs, they inhibit viral DNA polymerase. So this blocks the synthesis or replication of viral DNA. So this prevents multiplication of DNA virus in the human body. Now another drug, Fermiversion, it binds to viral messenger RNA of cytomegalovirus, and it blocks the synthesis of viral proteins. So this is how it blocks the multiplication of virus. So these are the mechanisms by which anti-herpes virus drugs stop multiplication of DNA virus in the human body. As already discussed, these are the main anti-herpes virus drugs. Now, idoxuridine and trifluridine are only used as eye drops or eye ointment for the treatment of herpes simplex keratitis, that is the eye infection. Then Acyclovir and Acyclovir, these two drugs, they effectively treat herpes simplex virus and varicella zoster virus infections. Then Gansey Clover and Gansey Clover are used for the treatment of severe cytomegalovirus infections. Then Cetophobia and Phoscarnate, they are used for treating Acyclovir and Gansey Clover resistant infections. Now let's discuss pharmacology of each of these drugs. Now, idoxuridine is a thymidine analog. So, structure of idoxuridine is similar to thymidine. Now, as we know now that thymidine is one of the building blocks of DNA. Trifluridine is a fluorinated nucleoside. It's structurally related to idoxuridine. So, both idoxuridine and trifluridine, they act by the same mechanism. So, as their structure is similar to thymidine, both these drugs compete with viral thymidine and they get themselves incorporated in the viral DNA in place of thymidine. And this results in the formation of faulty viral DNA that breaks easily. So these drugs prevent replication of viral DNA and thus herpes virus cannot multiply. But these drugs have several limitations. They have low virus selectivity. Thus, many a times they prevent replication of host DNA also, and thus they show high local toxicity. They also cause rapid development of viral resistance, and thus virus stops responding to these drugs and these drugs become ineffective. Now, because of these limitations, these drugs are used only topically as eye drops for the treatment of herpes simplex keratitis that is caused by HSV-1. Now, topical application of these drugs can cause ocular irritation and eyelid edema. So, this is the pharmacology of idoxuridine and trifluridine. Now, another very important drug is Acyclovir. Now, Acyclovir is the guanosine analog. So, structure of Acyclovir is similar to guanosine. Now, guanosine is a nucleoside that is made up of sugar and guanine base. Now, if phosphate is added to guanosine, it will become a nucleotide. Now, Acyclovir is a prodrug of Acyclovir. That means Acyclovir is metabolized to release Acyclovir in the body. Now, both these drugs are used for the treatment of infections caused by herpes simplex virus and varicella zoster virus. Now, oral absorption of Valcyclovir is much better than Acyclovir. Now, Acyclovir's bioavailability is around 20%, while bioavailability of Valcyclovir is 55 to 70%. Now, Acyclovir inhibits viral DNA synthesis and viral DNA replication. Now, when Acyclovir reaches herpes virus infected host cell, herpes specific or viral thymidine kinase converts Acyclovir to Acyclovir monophosphate. Now, cellular kinase or the host cell kinase further phosphorylates it, and this produces acyclovir triphosphate. Now, acyclovir itself resembles guanosine nucleoside. So, now acyclovir is phosphorylated. So, acyclovir triphosphate resembles a nucleotide. Now, very important, acyclovir triphosphate competitively inhibits viral DNA polymerase, and therefore now viral DNA cannot replicate. Now, in addition to this, as acyclovir triphosphate resembles a nucleotide, it gets incorporated in the replicating viral DNA strand, and this stops or this terminates DNA elongation. So, now the faulty DNA that is formed or the terminated DNA that is formed, this terminated DNA, this also irreversibly inhibits viral DNA polymerase. So, the acyclovir as well as valacyclovir, they produce their anti-herpes virus effect by causing inhibition of viral DNA polymerase. So, this is the mechanism of action of acyclovir and valacyclovir. Now, some important pharmacokinetic features of acyclovir and valacyclovir. Now, as already discussed, acyclovir has poor oral absorption, while valacyclovir has improved oral absorption. Now, these drugs are widely distributed in the body, including the cerebrospinal fluid, and therefore they are very effective in the treatment of herpes simplex encephalitis. Now, these drugs are primarily excreted unchanged in the urine, and therefore dose reduction is important in renal impairment. Then acyclovir has a half-life of 2 to 3 hours, while valacyclovir has a half-life of 3 hours. Now, let's talk about the clinical uses. Now, acyclovir and valacyclovir are very effective in the treatment of herpes simplex virus infections and varicella zoster virus infections. Now, these drugs are used in the treatment of HSV-1 as well as HSV-2 infections. Now, as acyclovir and valacyclovir treat herpes simplex virus 2 infections, they are very effective in the treatment of genital herpes. Then they also treat cold sores. Cold sores are also called as fever blisters or orolabial herpes. Then very effective in the treatment of herpes simplex encephalitis, herpes simplex keratitis, all these infections caused by HSV-1. Besides HSV-1 infections, these drugs are also used for the treatment of shingles and chickenpox caused by varicella zoster virus. Now, acyclovir is used topically as cream, orally as well as by intravenous route, while valacyclovir is given orally. Now, since absorption of acyclovir is quite good compared to acyclovir, valacyclovir has many a times replaced IV acyclovir. So, now let's see to the adverse effects of acyclovir. Now, topical acyclovir can cause stinging sensation, that is the pricking sensation, and burning sensation at the site of application. Then oral acyclovir can cause headache, nausea, malaise, that is feeling sick, and can also produce some central nervous system adverse effects. Now, intravenous acyclovir is toxic and it produces nephrotoxicity. It causes dose dependent fall in the glomerular filtration rate. Now, adequate hydration and dose adjustment is essential to reduce the nephrotoxic effect of acyclovir. Now, another major adverse effect of acyclovir is the neurological toxicity. Now, high doses of acyclovir can cause tremors, hallucinations, convulsions and coma. In addition to these adverse effects, rashes, sweating, emesis, that is vomiting, and fall in blood pressure can also occur in few patients. So this is a pharmacology of Acyclovir. Now it's very important to remember that Acyclovir and Valacyclovir are very effective in the treatment of infections caused by Herpes Simplex Virus and Varicella zoster virus. Now next very important drug is Gansey Clover. Now Gansey Clover is a prodrug of Gansey Clover. So Gansey Clover is metabolized in the body to produce Gansey Clover. Now these drugs, they differ in their pharmacokinetic parameters. Pharmacokinetics of Gansey Clover is much improved compared to Gansey Clover. Now Gansey Clover is an analog of Acyclovir. So mechanism of action of Gansey Clover is similar to Acyclovir. Now Gansey Clover is active against Herpes Simplex Virus, Varicella zoster virus as well as cytomegalovirus. But because of its high toxicity, its use is restricted for the treatment of severe cytomegalovirus infections. So now Gansey Clover is phosphorylated to Gansey Clover monophosphate by cytomegalovirus coded UL97 viral kinase. Further, it is phosphorylated to Gansey Clover triphosphate by host cellular kinase. Now this Gansey Clover triphosphate, like Acyclovir triphosphate, this also resembles a nucleotide, and therefore it gets incorporated in viral replicating DNA strand. So this stops or this terminates DNA elongation. Now in addition to this, Gansey Clover triphosphate competitively inhibits viral DNA polymerase. So Gansey Clover inhibits viral DNA synthesis, it inhibits viral DNA replication, and therefore it stops multiplication of virus. So this is the mechanism of action of Gansey Clover and Gansey Clover. Now some important pharmacokinetic features. Now Gansey Clover oral bioavailability is less than 10%, whereas Gansey Clover has higher, much better bioavailability. Both these drugs are excreted unchanged in the urine. Gansey Clover half-life is 2 to 4 hours, while Gansey Clover half-life is 24 hours. It is more than 24 hours. Now uses of these drugs, as already discussed, use is restricted to prophylaxis and treatment of severe cytomegalovirus infections like pneumonia, colitis, then retinitis. In immunocompromised patients like AIDS patients, then transplant recipient patients. So these are the clinical uses of Gansey Clover and Gansey Clover. Then adverse effects. Now Gansey Clover shows high systemic toxicity. Now precursor cells in the bone marrow are quite sensitive to Gansey Clover. So Gansey Clover causes bone marrow depression resulting in pancytopenia, that is fall in the number of red blood cells, white blood cells and platelets. Now Gansey Clover also produces neuropsychiatric disturbances. Rashes, fever and vomiting can also occur. So this is the pharmacology of Gansey Clover and Gansey Clover. Now important to remember that Gansey Clover and Gansey Clover are used in the treatment and in the prophylaxis of severe cytomegalovirus infections. Now another drug is the Cetophobia. Now important to remember that Cetophobia is used in the treatment of herpes virus infections that are resistant to Acyclovir and Gansey Clover. Now Cetophobia is a monophosphate nucleotide analog of cytidine. Now here it's very important to understand that cytidine is a nucleoside in which cytosine is the base and it has a sugar. Now, if a phosphate group is added to this cytidine, it will become a nucleotide. Now, structure of Cetophobia is similar to cytidine. Now, in addition to that, Cetophobia also consists of a phosphate group. So, Cetophobia is a monophosphate nucleotide that is an analog of cytidine. Now, Cetophobia is a monophosphate. So, the kinase enzyme of the host cell further phosphorylates it and converts it to Cetophobia diphosphate. Now, Cetophobia diphosphate inhibits viral DNA polymerase, and thus it inhibits viral DNA synthesis and replication. It prevents multiplication of DNA viruses. Now, Cetophobia inhibits DNA synthesis in Herpes Simplex Virus, Cytomegalovirus, then Pox virus and adenovirus. Now, Cetophobia has a very poor oral absorption, and thus it is given by IV infusion. It is also given topically. Now, clinically, Cetophobia is used in the treatment of cytomegalovirus retinitis in AIDS patient. Now, first in cytomegalovirus retinitis, Gansey Clover is given. Now, if Gansey Clover therapy fails, that means the infection is resistant to Gansey Clover, then Cetophobia is used. It is also used in the treatment of Acyclovir resistant mucocutaneous herpes simplex in immunocompromised patient. Now, as it is effective against herpes simplex virus infection, it can be used topically in the treatment of anogenital warts. Now, nephrotoxicity is the major adverse effect of Cetophobia. It causes dose-related kidney damage, but nephrotoxicity can be reduced by the administration of probenecid and IV fluids. Then gastric disturbances, hypersensitivity reactions, neutropenia and uveitis, that is inflammation inside the eye, can also occur. So again, important to remember that Cetophobia is used in the treatment of Gansey Clover resistant cytomegalovirus retinitis and Acyclovir resistant mucocutaneous herpes simplex. Now, another very important drug is the Phoscarnate. Now, to understand mechanism of action of Phoscarnate, let's understand how nucleotides are added to the replicating DNA template. So, look at this figure. Now, here this represents a nucleoside. Now, when 3 phosphates are attached to this nucleoside, it becomes a nucleotide. Now, this nucleotide is a building block of DNA. Now, when one nucleotide is added to the DNA template, at that time, one pyrophosphate, which is made up of 2 phosphate, is released. Now, let's assume that there are 2 arms of the DNA polymerase. With one arm, DNA polymerase picks up the nucleotide and incorporates this nucleotide in the elongating template of DNA. And with the other arm, DNA polymerase picks up the pyrophosphate that is released. Now, the process of nucleotide addition to the DNA is not completed unless and until the pyrophosphate is removed. And removal of pyrophosphate is done by DNA polymerase. Now, Phoscarnate is a pyrophosphate analog. It inhibits viral DNA polymerase as well as reverse transcriptase. Now, let's see what Phoscarnate does. Now, Phoscarnate attaches to the pyrophosphate binding site of the DNA polymerase. So, it inhibits DNA polymerase by attaching to its pyrophosphate binding site. So, once it is attached to the pyrophosphate binding site of DNA polymerase, now DNA polymerase cannot remove these pyrophosphates. So, since these pyrophosphates are not removed, nucleotides are not added to the replicating DNA template. So, this blocks the viral DNA synthesis and replication. So this stops the multiplication of virus. Now, Phoscarnate has poor oral absorption and therefore it is given by IV infusion. Its half-life is 4 to 8 hours and it is not metabolized. Now, uses of Phoscarnate. Now, Phoscarnate is used to treat only resistant cytomegalovirus and herpes simplex virus infections because it is highly toxic. So, Phoscarnate is used in the treatment of Gansey Clover resistant cytomegalovirus retinitis and other cytomegalovirus infections in the AIDS patients. It is also used in the treatment of Acyclovir resistant herpes simplex virus 2. That is, it is also used in the treatment of Acyclovir resistant genital herpes. Then it is also used in the treatment of varicella zoster infection in the AIDS patients. Now, the adverse effects of Phoscarnate. Phoscarnate is highly toxic. Now, it causes nephrotoxicity, and because of the nephrotoxicity, acute renal failure can occur. It also causes neurological toxicity, and because of this toxicity, tremors, convulsions can occur. Now, basically, these tremors and convulsions occur because of electrolyte abnormalities induced by the Phoscarnate. For example, Phoscarnate causes hypocalcemia. So, hypocalcemia causes occurrence of convulsion. In addition to this, Phoscarnate can also cause nausea, leukopenia, neutropenia. So, this is the pharmacology of Phoscarnate. Very important to remember here that Phoscarnate is used for the treatment of Gansey Clover resistant cytomegalovirus infections and Acyclovir resistant genital herpes. Now, the next drug is Phormiversion. Now, Phormiversion is an antisense oligonucleotide. Now, if you could remember, we have studied that in the host cell, the virus, the cytomegalovirus, it transcribes to produce viral messenger RNA. And viral messenger RNA further produces structural and functional proteins which are required for the multiplication of virus. Now, Phormiversion binds to messenger RNA of cytomegalovirus and thus it interferes with the synthesis of viral early proteins like for example, it interferes with the synthesis of viral DNA polymerase. It interferes with the synthesis of viral kinases which are required for the replication or multiplication of virus. So, Phormiversion prevents viral multiplication by binding to messenger RNA of cytomegalovirus. Now, Phormiversion is used in the treatment of cytomegalovirus retinitis resistant to Gansey Clover, Cetophobia and Phoscarnate, and it is administered by ocular injection. Now, Phormiversion has been discontinued in USA due to its common ocular complications. So, this is the pharmacology of anti-herpes virus drugs. Now, let's answer few multiple choice questions based on these drugs. Now, the first question, Gansey Clover is preferred over Acyclovir in. Now, here we should know the clinical uses of Gansey Clover and Acyclovir. Now, from whatever we have studied, we have come to know that Acyclovir is used for the treatment of herpes simplex virus infections and varicella zoster virus infections, whereas Gansey Clover is used in the treatment of cytomegalovirus infections. So, this we know. Now, let's see what are the options. Gansey Clover is preferred over Acyclovir in Herpes simplex keratitis, no, here Acyclovir is used. Then herpes encephalitis, no, here also Acyclovir is used. Chickenpox, no, here also Acyclovir is used. Then cytomegalovirus retinitis in AIDS patient, yes. So the correct answer is Gansey Clover is used in the treatment of cytomegalovirus retinitis in the AIDS patients. Then next question is on idoxuridine. With regards to idoxuridine, 4 options are given here. Idoxuridine is administered orally. No, it is given in the eye. It is used as an eye drop. It is not administered orally. It is the drug of choice in genital herpes. No, it is used only for the treatment of keratitis. Then it acts by inhibiting viral DNA synthesis. Yes. This idoxuridine, it is a thymidine analog. It gets incorporated in the elongating viral DNA and it terminates that. So it acts by inhibiting the viral DNA synthesis. Then it is a guanine nucleoside analog. No, it is a thymidine analog. So the correct answer is idoxuridine acts by inhibiting viral DNA synthesis. Then another question, derivative of pyrophosphate. So these are the 4 drugs. Now we know that Phoscarnate is the derivative of pyrophosphate. So the correct answer is Phoscarnate. Then Acyclovir treats, now here we should remember what the clinical uses of Acyclovir, all herpes infections and all varicella zoster infections. So Acyclovir treats herpes zoster virus, yes. Chickenpox, yes. Genital herpes, yes. So the correct answer is all. The correct option is all. Option D. Then Acyclovir resistant herpes simplex. Here we should know the drug that treats Acyclovir resistant herpes simplex virus infections. So the options are Valacyclovir, no. Gansey Clover, no. Phoscarnate, yes. Phoscarnate is used for the treatment of Acyclovir resistant herpes simplex virus infections. Then Fermiversion, no. Fermiversion is used only for the treatment of cytomegalovirus retinitis. So the correct answer is Phoscarnate. Phoscarnate is used for the treatment of Acyclovir resistant herpes simplex virus infections. So these are the few multiple choice questions. So this is all about the pharmacology of anti-herpes virus drugs. Please note, information provided in this video is only for the informative academic purpose. For the use of any of these drugs or for the treatment of herpes infection, you must consult your physician. If you like the video, kindly like, subscribe and share this video. Thanks for watching this video.